Hello, this is Dr. Gay from First Look MRI, and this is a 54-year-old female with complaints of left wrist pain and swelling. The doctor thought there could be a ganglion cyst, so that's why they performed the scan. And we didn't see a ganglion cyst, but they had lots of little findings scattered around. I'm just going to highlight a couple of these. Number one, this is the lunate bone, triquetral bone, and a little ligament that goes along the undersurface here, the lunatotriquetral ligament we just don't see. Typically, you'll see a little linear band there. The bones are closely opposed, so there's no widening, but I just don't see the lunatotriquetral ligament. There's another thing that looks like the ligament, but it's bowed way down here, touching the TFCC, so I'm not sure if that's part of it that's stripped off and hanging in the breeze, or fluid is pushing that down. I don't see a lunatotriquetral ligament, so that looks like it was probably torn. And the other main finding was over here on the radial side of the wrist. They didn't complain any problems over here, but there was thickening in this. So over here in the wrist, here's the radius. If we come proximal to the wrist, we see a muscle. This is the extensor pollicis brevis muscle. It wraps over these two here. These are the extensor carpi radialis longus and brevis tendons here together. And we have two of them will drape across. The one that's more proximal is the pollicis brevis, the extensor pollicis brevis muscle, drapes across, and then the tendon comes on up, over here to the base of the thumb, and the tendon is too thick. It starts here near the metaphysis, and it's just too thick and strange looking. So this is a hypertrophic partial tear. We'll look at this on axial images, and let's try to find the longus. So this is the brevis, the muscle, that white area, turning into a tendon, kind of clear as mud. But now the longus will come off more distally, and see if we can find it. Oh, there it is right here. So here it is, coming off obliquely, and again it crosses right over these two structures. Here it is, makes a turn to the left, comes up here. So this is the longus and brevis. See how far apart they are here. Now we're going to go to the axial images and see if we can see these same things. Again, here's that longus, and here's the brevis. Now we're going to start distally. Here's the thumb area. That little bitty thing here, this is the longus, extensor pollicis longus. We're going to follow that here. There it is. Maybe a tiny little bit of fluid in the tendon sheath. And here are these two guys next to each other, the longus and brevis, extensor carpi radialis longus and brevis tendons. You can see how this pollicis goes over the top, just like that. And then it gets into its normal position here. So it goes up, makes the turn, jumps across. Now we're going to go down into the proximal area, more proximal to this. Here's the radius. And over here is the longus. So we're going to follow that all the way back to where it crosses over. We're catching a little bit of that muscle that looks bright. And the tendon is here. We have these two, the longus and brevis, extensor carpi radialis. And then here's the muscle. Now this is the tendon of the extensor pollicis brevis. And if we follow this down, we see this glob. It's just way too big, irregular. Looks like there's 1, 2, 3, 4 pieces of it rather than just one piece. So clean these ones are. So this is a hypertrophic partial tear, and there's also some longitudinal split components. If we follow this more distally, we see that there are two components here. There's a third one here. This is just another tendon, the abductor pollicis longus right there. And then this is the extensor pollicis brevis that is split. These tendons here along the radial wrist, they just form one big glob. It's hard to separate them until they distally here we can see this attaches more proximal, and the extensor pollicis brevis goes all the way up here distally. If we follow this back down, we can see the two split components. 1, 2, 1, 2, 1, 2, and then this comes into this more hypertrophic partial tear. So this is a case of a complex appearing hypertrophic partial tear with longitudinal split components of the extensor pollicis brevis. And then the longus again, which is more distal. Over here looks fine. And that's it. Thank you.